welcome everyone to ShinKyu University. Today I'm really excited to be interviewing and introducing Nigel Dawes. Many of you probably already know about him and his work with Kampo medicine and teaching Kampo, and so I'm really excited to introduce his story of how he got into the medicine and his advice to all of you to learning this medicine. As always, if you got some benefit from this video, I would very much appreciate if you like, subscribe, and hit that little beep bell to be notified of future videos coming out all about Japanese acupuncture, moxibustion, Kampo, and so much more. And so without further ado, we're going to get into the interview today with Nigel. So Nigel, if you would maybe give me a little bit more in-depth introduction of yourself, I'd appreciate it.
Maya, thank you. Well, first of all, thank you very much for inviting me onto this platform. And I'm a little unused to doing social media things, but I'm very hopeful that if even if it reaches a few people, I'm happy to talk about things that are close to my heart anyway. Certainly. How did I get into this stuff? Well, actually, I do not have one of those, I think, relatively common stories, at least in my experience, common. That is to say, people who themselves perhaps were either sick or ill or suffering something, or had an encounter with a particular individual or several individuals who sort of, changed their life and then they became a convert. I don't have that experience. I actually was in Japan for different reasons in my 20s, back in the 1980s. And I was teaching English, like many people, many foreigners at the time, kind of hanging out after college. I did a master's in comparative literature. So that was my background, very much not connected to medicine. But, I was sort of a little bit of a confused young person, not quite sure what I was about. And I'd always had a fascination with East Asia in general. I must confess, I had more connection through my literary studies with China, actually, or ancient China, and had imagined maybe going there. But I don't. Many of the listeners already might know this, but back in the 1980s, it was quite difficult to get into China. You had to be on a special tourist visa, and even then, you were sort of guided around, and you certainly didn't have freedom of movement at all. So I decided against that. I didn't have any money either. So someone said to me, "Oh, you go to Japan because you can get a job, you can teach English, you'll do well, and maybe you'll meet." Anyway, long story short, it's exactly what happened. I took up residence in Tokyo. In the beginning, I did not have Japanese. My spoken Japanese is still pretty poor, though I can sort of fumble along reading this and that these days. I started off teaching English, and I, sure enough, met a crowd of very interesting people, because I think in those days, Japan was not on the backpacking circuit. It was too expensive for that. So people who were foreigners that were there at the time, and this, Maya, because you lived there many years, they were busy doing something. Typically they were studying. So I met, for example, a lot of martial artists, some people who were studying some interesting aspects of Japanese fine arts, like shakuhachi, like music things, or ikebana, or all kinds of things, really. And then one day I met this guy, Peter, who became a very close friend of mine, who was also an Englishman. And he was studying acupuncture, and I was like sort of semi-intrigued, and I was like, okay, well, he said, he had this thick Northern English accent. So he said, "Come on, Nigel, why don't you come up to the class, sit down, you might like it." So that was literally my first introduction to acupuncture, was sitting in a class of obviously interested and committed foreigners studying acupuncture with these two Japanese teachers in a kind of deliberately foreign setting. In other words, they had figured out that there were some foreigners around who wanted to study, and there weren't really, the Japanese acupuncture school, of course, required fluent Japanese, so before you could get in. So they had figured out, well, there's a little niche here for us to teach foreigners outside of the system, kind of thing. So I joined that class pretty much straight away, and as they say, the rest is kind of history, because it was a 3-year program. They didn't tell you at the time that when you graduated the class part of it after 3 years, that they wouldn't give you the diploma until you found a sensei and worked with them in their office for at least 2 more years. So actually, it was a 5-year thing, really, in the end. So I stayed in Japan for 5 years, had a great time. I mean, I was looking back, I was very, very lucky, because I could work, 10 hours or 12 hours a week teaching English, and at the same time earn enough to pay all of my tuition and stuff, so it was crazy in a way, compared to some of the young students now who have to take out loans and all that stuff, which luckily I never had to do. So I consider that a privilege. And it was a very small, kind of intimate setting, semi-traditional in the sense that, we were close with our teachers all the time and in the clinic seeing patients, and it wasn't really an academic school setting. In fact, we didn't study any Western medicine at all at that time. And later on in my training, when I went back to London, I had already started to notice that as a kind of a gap in my education. And I went to night school, believe it or not, to study anatomy, physiology, pathology, and all the rest of it for a couple of years, Western medicine. So I did things a little bit piecemeal. As I say, that 3 years was primarily acupuncture and shiatsu study. We studied shiatsu alongside acupuncture all the time. And then I found separately outside of that school, I encountered a very close became very close teacher of mine in shiatsu, actually, Suzuki Sensei, who had been teaching at Iokai, the shiatsu center, Masunaga Shiatsu Center in Tabata, actually in Ueno, I should say. And so that became a sort of a parallel study of mine with shiatsu, and I still hold that very close to my heart. And I think I've been influenced a lot in my work by the hands-on stuff of shiatsu, particularly when it comes to Kampo, actually, with the fukushin and the abdominal palpation that we do in that system. The method or the kata that I use is very much influenced from my shiatsu training. So yeah, those are my three disciplines, really: shiatsu, acupuncture, and Kampo. I'll say a bit more about Kampo in a second. But the acupuncture side, just to mention, it was a little eclectic because my main teacher had studied partially in China. So that, interestingly enough, there was some almost quasi TCM style teaching that he was doing, which is very unusual, actually. I later found out, I didn't realize because I didn't know much about anything then. But the other teacher, there were two main teachers, had been trained in the Keiraku Chirio style, so the meridian therapy style of, well, nowadays we think about Shudo Denmei, for example. He's still living, of course, and working in Tokyo. But that whole tradition that began in probably 1930s or so in Japan, based on five element and Nanjing teaching, really. So that was like my kind of main influence, I suppose, in the acupuncture style. That I learned. And yeah, in terms of Kampo, the problem in Japan at that time for me was that I was not a medical doctor. Problem meaning that I could not have access to study. I found this out. It took me a little while to figure out that, if you want to study Kampo, you have to be a physician or a pharmacist. To our great fortune at the time, there was a New Zealander by the name of Peter Townsend, who was a licensed pharmacist from New Zealand and had married a Japanese and was living in Tokyo and had very good Japanese. And he was studying at the institute called Kitasato, which is still open, still very much functional in Tokyo, which is the main Kampo research and teaching institute of Japan, actually. So he was a student there, and we kind of collared him because that's how it was then. There was a relatively small foreigner community, and once you got within the Toyo Igaku, community, then it was very small. So we kind of collared him, and those of us who were interested in Kampo and said, well, please teach us, So I had my first kind of rudimentary Kampo classes with Peter, with a bunch of other students, and we studied primarily theory. So we primarily studied formulas, did formula study for a couple of years. So I didn't really get a whole lot of clinical exposure in Kampo in Japan, funny enough. It was just not possible to get access to those clinics. So having graduated acupuncture and shiatsu school and done my 2 years in the clinics with my other teachers, my clinical teachers, I went to China. I was 6 months in China. And I then ended up back in England, where I'm from, obviously. I think, obviously, from my accent. I ended up back in London. And then again, these things are serendipitous, certainly. I arrived in London. Within 2 months of my arriving, one of my very good colleagues and teachers from Japan days, who's American herself, she's from Virginia originally, had married an English guy in Tokyo and decided to come back to London. So here we were. Now, she had been the only other foreigner that I knew of at the time, other than Peter Townsend, who I mentioned, to have also studied at Kitasato, Kampo, under Dr. Otsuka, actually. Dr. Otsuka, so the direct lineage of the Otsuka tradition. And so, again, in London, me and one other person, Veronica, who's from my shiatsu school in Tokyo, we pestered Gretchen to please teach us clinically Kampo, so some kind of clinical training. And she formed this program that she still teaches now, actually, called the Kampo Internship, where she took people who wanted to do clinical study, and we worked with patients for 2 or 3 years actually with her, very much in an internship setting. So again, just to illustrate, my training is a little eclectic. It was sort of acupuncture first and shiatsu, then a little bit of Kampo in Japan, left Japan, went to China, did a lot of TCM stuff, which was interesting. I mean, I certainly was interested. It just didn't gel with me particularly. I was much more interested in the more tactile aspects of the Japanese stuff I'd learned. So I kind of stayed with that really. But I certainly had a good time in China, and my goodness, you see a lot of patients in China. That's for sure. And then back in England, I was spending the first 2 or 3 years studying at night school Western medicine, and then during the day I studied with Gretchen and did my clinical Kampo training. So by the end of it all, it was probably around 10 years. I sort of finally felt like I was coming to a point where I could, maybe offer something. So that was sort of, I think I was around 30 by then. I was living in London, and that's when I sort of opened my first practice, was back in probably, I don't know, 1989, maybe 1988, something like that. Yeah.
So you didn't,
Yeah.
so you were studying for that 10-year period, but you weren't treating patients directly. You were observing them?
Mostly observing. I mean, I wouldn't say that I couldn't have claimed I had my own patients. No, certainly in Japan and China, we were under supervision more or less always. So yes, we were training. We saw a lot of patients. Again, certainly in China, we saw lots of patients, but yes, under supervision. So yeah, my first individual private practice was in London in the late 1980s. Yeah, when I kind of started out on my own, very nervously. Kind of like, luckily Gretchen was there and she had a lot more experience than me, and that was super helpful. And at one point we were actually working together in the same clinic, which was really nice. But
That's very nice.
yeah.
The
So
first
I sort of cut my teeth a little bit in London actually. I lived there for about 6 years before I came to the United States in 1994, I think it was. I came here first. So goodness, ever since then I've been here, which is a long time, 28 years. Yeah. All in New York.
So I know that right now, I mean, you're kind of famous within the Japanese medicine community for really Kampo in particular. Is that when you're in your clinic, is Kampo the main focus of your medicine, or is shiatsu also a main focus for your treatment as well?
No, that's a great question. I mean, part of the answer to that, I think, is not just what I feel that I have an affinity for and that I want to do, and that also that I feel more, if you like, more confident and settled about, which if I was to answer that question, I would say shiatsu and Kampo. And less acupuncture in my own internal world. And I should explain by that, I mean that in my opinion, I find acupuncture the most challenging of those three disciplines. And that may be a surprise to some people who might have been taught possibly at their school that, there's body work and then there's acupuncture and then there's herbs somehow at the top. I certainly don't see it that way. And I feel about herbs that there's more of a prescribed structure to it, to the practice of herbs, such that if you put your mind to it and you have a reasonably good memory and a good applied practice, you can come to some sort of level of somewhat mastery or proficiency at it, I think, more quickly than you can with acupuncture. Acupuncture is so open-ended and there's so many possibilities. And you try this treatment with this patient this time and it works really well, and then you think, oh yeah, let me do that again, and it doesn't work. It's a very interesting open-ended thing, acupuncture. So I find it more challenging, to be honest with you. I think I'm reasonable at it, but it's not my like my real focus is hands-on work. And then I do love the herbs. Yes, I find internal medicine intrinsically fascinating. The combination of using a lot of mind with your hands. I love touching the patient, getting a sense directly through touch, but also then having to process something quite intellectually in a way, but in a very careful way, in a very sort of deductive way. I find my mind is, maybe because I studied comparative literature, I have this kind of somewhat analytical mind with regard to, reading something and then analyzing and then writing about it. Maybe that was a training that helps me now in my clinical work, possibly, I don't know. But in terms of how patients react, because that was the second half of my answer, it's interesting because when I first came to New York, for example, I was thinking to do a lot of shiatsu, but people didn't really seem to warm to it so much. And they were more open to acupuncture, actually. So in terms of actually, yes, it was quite interesting. I found that people are very open to acupuncture in New York and seem to know more about it, and it's more accessible. They know very little about herbs, and they don't know a whole lot about shiatsu. So just in pure practical terms, I've found a great deal of my patients, I do acupuncture with them. Yes, I do. So it's interesting.
It's what you said just makes a lot of sense to me. So currently I'm in your online study group, and it's a lot of information.
Yes, it's probably
yeah, because I think I'm kind of I'm almost the exact opposite, I think, of you, Nigel, just listening to your explanation, in that I love, as you do, love touching the patient, palpation, and learning from the patient, but I have a really poor memory. So I have a really hard time remembering the herbs and all of the categories and all of those things, whereas I have a much easier time taking the technique and applying it very differentially to the patient, because it doesn't require a lot of memory. I like to joke with my students that I have Alzheimer's or something, because I just can't remember anything. Just my memory sucks. So it makes a lot of sense how you were describing how you can, the Kampo is very theoretical, but in practice, you're kind of combining the shiatsu touch and palpation in order to really deduce down how you're diagnosing that client, and then taking all of that information and putting it back into your brain and saying, okay, with this information, it's going to be this herb and this herb and this herb, but it can't be this formula at all. I think it's really important to touch a little bit more on the differences between TCM, Chinese style herbology, and the Japanese Kampo, because from a teacher's perspective, especially, and also, you've helped translate several books as well, and there's really a huge difference between how they're learned and how they're practiced. At least I've noticed since coming back to the US from Japan. So could you touch a little bit on that from your experience?
Sure. Well, actually, that's interesting, because it does relate back to your point about memory, in my opinion, because I also don't have a great memory either. Not an isolated kind of textual memory of, this and that. So, for example, the modern TCM methodology of learning herbs, as I'm sure you know, and many of the listeners would know, requires you to typically start with study of individual herbs first. And there are a lot of them. like 400 or something. And for every single one, there's, as you mentioned, there's categorization, and there's the meridians entered, and there's the taste, and then there's a whole lot of aspects of memorized knowledge that are required. So that really is a memorization process. And then when you move next to the formulas, they're also in TCM style. They're presented according to usually the Zhang Fu syndrome, to which they would appropriate. And again, that's quite a lot of memorization. Now, Kampo takes a very different approach to both the study and practice of herbs, which has helped me, and I think that's why it appeals to me, that the memorization process is not abstract. Yes, there's quite a lot of information, definitely. I would say a lot more information, let's say, certainly than shiatsu. Shiatsu, there's not a whole lot of information, but there's a lot of practice that you need to do. So there is information, but let's start in the beginning. When you study Kampo, you don't study individual herbs from the beginning at all. You study formulas from the beginning. And when I say study, you don't study the formulas in the same way as modern TCM. In other words, for example, to a Kampo student, it's not relevant at all in the beginning. Maybe later on, maybe 10 years later, after you've been using that formula clinically with several patients, you may be curious about the ingredients and the dosing of individual herbs in that formula. But when you begin study, and for the longest time in the early years, you're deliberately discouraged from paying any attention to dosing or individual herb components of any given formula. And all of your, if you like, memorization faculties are focused on the very clinical, descriptive language of how you use that formula. And it's very specific. So there's always a pulse and a tongue and an abdomen conformation and a bunch of signs and symptoms that characterize the particular clinical picture of that formula, without reference particularly to Zhang Fu or abstract, syndromes per se. In other words, we don't use the term, oh, this formula is used for the such and such syndrome. We say this formula has a pattern, and this is the pattern of that formula. And that pattern is described in the language of symptoms, including pulse, tongue, and abdomen. So I think at least for me, when I'm trying to memorize a formula in the Kampo system, it's immediately much more visceral to me because the description is clinical and physical and based on your sensory experience of recognizing symptoms and tactile signs in a patient immediately. There's no abstract theory that you have to refer to. There's no yin or yang or Zhang Fu or, this, chi stasis or any of those which are all important concepts in our medicine, but they're not used directly in the moment of study of the formulas or in the moment of diagnosis with a patient. So I don't know if that captures a difference for you. That's really rather important because the aim, as far as I understand it in TCM herbology, when you get good at it, is to consult with a patient, use your faculties to understand as best you can, and then actually write a prescription, compound a formula, typically one herb at a time, and the rationale for each herb is explained because of the functions of that herb with regard to the pathology of that patient. Now, that's a very detailed process, but it's also a little bit theoretical, as opposed to this clinical picture that epitomizes this particular formula, and the patient's confirmation either matches that pretty accurately or it doesn't. And if it doesn't, it's another formula. So I'm not, almost like a lock and key system that I believe, I'm not very familiar with classical homeopathy, but I believe they use something similar in homeopathy with regard to this, the patient and the remedy fit. Do they fit or do they not fit?
Well, I really like that too, because I think you summarized not only Kampo, but also Japanese medicine approaches for many different classical styles really well there, saying that, with the TCM, it's very much so this system equals this point or this herb, or, you have to do this specific treatment. And then you compound all those points together, and now you have your acupuncture treatment or you have your herbal formula, right? Whereas in Japanese medicine, it's very much that clinical picture of the patient. So the patient has kyokyo kuma, and they have distension, maybe in their, they have all of these different things and components. And then based on that, you're going to then take your herbs, your Kampo formula, or you're going to take your acupuncture and your moxibustion, or even your shiatsu, and you're going to apply this specific kind of treatment molded to the patient a little bit eventually, right? But initially, you're just going to take what your teacher tells you for that patient, and you're going to copy it and do it. So that way you can understand how that prescription really applies to that clinical presentation. But it's really important, I think, for people to understand that clinical presentation is not a theoretical verbal understanding of the patient, but a palpatory, hands-on, physical presentation that is so much different. So I loved how you encapsulated that, and I mean, I think my next question for you, I'm not sure if you'll be able to answer really, because usually I ask people, well, how did Japanese medicine change your practice in particular? But I think you're a bit like me, Nigel, that both of us started out without having a TCM practice.
I didn't have anything else. As I often say to people, like, I'm really boring because I've never done anything else in my life. only acupuncture starting in Japan. So yes, I mean, in some ways, it's almost the other way around. TCM, when I got to China after 5 years in Japan, I think there was a possibility that TCM might have influenced me and shifted my direction quite a bit, because initially, and for the whole time I was there, it was about 6 months, it was very fascinating. I mean, I just the sheer numbers of patients alone was almost overwhelming. I couldn't, we used to see 50 patients before lunch. I mean, it was crazy in the hospital. So there were a lot of very exciting things. We saw surgeries, we saw, all kinds of stuff. So there was a lot that I had not seen in Japan. But I think after a couple of months, I sort of settled down and began to kind of realize, or I guess identify for myself the strengths and weaknesses in as I saw them in these approaches, and what suited me. And I began to realize that in fact what I'd learned in Japan was really had become a deep part of me, and I liked it, and I liked the sensibility of it. And even though those Chinese patients were saying, give me more, I was like still very happy with my kind of quite gentle approach. And I also sort of thought ahead, which turned out to be somewhat true, I may say. I also thought ahead to my potential patients in the West, who I kind of thought maybe wouldn't be quite the same as the Chinese population patients, who were very used to acupuncture in their culture, and they wanted strong stimulation. For the most part, they wanted an experience that was very dynamic. And sure enough, I think in London and America generally, I found that most of my patients respond quite well to the more gentle approaches. Of course, I'm generalizing, but I think something about that Japanese had penetrated me enough that yes, I didn't really deviate from that particularly. Yeah. Although I learned a lot in China, for sure. I learned a huge amount. And some of those techniques I do use, particularly some of the orthopedic techniques with the sort of intramuscular needling and things like that. I definitely use some of that stuff. And some of the adjunct things like cupping and gua sha and all those things were very interesting as well. So yes, I do certainly incorporate that. But yeah.
Well, when it comes to, I mean, I guess your process then, could you kind of walk me through your process with a patient? Because I know, so I did go to one of your in-person lectures, and I did ask you this question because I ask so many questions all the time. I asked you a question in particular, like how, in what priority are you using different faculties of the medicine, right? So when you have a new patient come into your office, what's your process? I'm sure you do pulse, tongue, you do your Hara diagnosis. And then at what point do you go, yeah, this patient is going to be just Kampo, or this patient I'm going to do shiatsu, or this patient I'm going to do acupuncture? What's your deciding factors?
Well, unless the patient's already asked me in advance that, which happens, some people sometimes say, I'm coming for herbs, or I want acupuncture, or, but assuming that they're coming open-ended, that first visit, I will be treating them with acupuncture and shiatsu. That's what I'll be doing. Certainly, I'll be touching them quite a bit, which includes the shiatsu part, yes. And I don't prescribe herbs in the first visit. That's the first thing to say. Now, there's a reason for that. Firstly, because I couldn't say an exact percentage, but I'll give you a guess. I'd say maybe around 70%, 65, 70% of my patients take herbs. In other words, not everybody takes herbs. So I'm assuming that first visit that perhaps this patient may not need herbs. The second reason for not prescribing is because I want to see their response to needling and shiatsu and some gentle energetic work. And that might tell me something more about that patient in regard to possibly herbs or no herbs, or yeah. So I'm always a little cautious with the herbs in the beginning, and I hang off a little bit. Now, in regard to specifics, I always like to hear the person's story. So I give them a lot of time for that. I really like to hear in their own words, what's going on, and I encourage them, so that part of it can take a while. I just listen, I'm really curious to notice what that person will emphasize. And they may start off in a sort of rote way, but then if they get more comfortable and relaxed, they start to tell you other things that become very interesting and useful. So the first part of an interview for me is just listening, really. I don't take their pulse or do any physical exam in the beginning. And for me, the most important part is let them tell their story till they get to the end of it. Make sure you get a medical history and a family history, but don't ask too many questions of your own at that point. That's I don't like to ask them a lot of, Japanese medicine questions yet, because I like to reserve those until after I've done the tactile and observational thing on the table. So they speak, you get a medical history and a family history, and then you get them on the table. That's what I do. Now, on the table, it's interesting because the first visit, since I'm not going to do herbs, the abdominal palpation I do is mostly orientated towards my acupuncture. So that's a different system. And I will do that along with the pulse and look at the tongue at the beginning of the session. And all of that information is kind of informing me about acupuncture, point selection, and approaches and stuff like that. Now, at a later session, if I'm prescribing herbs, the way I do it is in meridian therapy style with acupuncture, we always do 2 rounds of needling, usually referred to as the root and the branch treatment. So the root treatment is based on pulse finding alone. So the first phase of this is anything after the first visit, any follow-up visits, I'm feeling the pulse first and placing a first round of needles without looking at the tongue and without palpating the abdomen. And that allows me to sort of get a sense of meridian flow and just purely focus my intentionality on meridians and energy flow and balance, basically. When that first round of needles come out, check the pulse, make some, try to get an assessment of any changes there. Then I'll look at the tongue and palpate the abdomen. Because for me, the tongue and the abdomen represent yin forms of diagnosis in the sense that they, to my mind, they reveal more about the internal imbalances of a patient as opposed to the pulse, where everything's about the meridian flow and the movement of chi, which is not necessarily internal or external, but it's let's say not the same direct degree of internal medicine, let's call it that. So I don't know, that's a bit of a complicated answer, but yeah, first visit, no herbs, a lot of tactile stuff, a lot of listening, get a sense of the person, and then watch and see how they respond to the needling and the shiatsu, and then consider, and I might make at the end of that session, if I have a sense that they'd be a good candidate for herbs, I'll probably mention that to them and say, like, next time we'll do an assessment, I want to check for herbs because I think you're going to do quite well with some Chinese medicine as well. So I go, but so I have a little bit of a sense of different hats. I try to only wear one hat at a time. If I've got my acupuncture hat on, my whole sensibilities around meridian and subtle energy flow and balance and excess and deficiency mostly. Whereas when I've got my Kampo hat on, it's more formulas are in my mind, and I'm forming questions for the patient from the formulas I'm already thinking about that might be suitable for them, and so on and so forth.
So it sounds like your acupuncture has more of a keirakchiro, more of a Japanese meridian therapy approach to it. Is that correct?
Yes, and it's very interactive. So during the treatment, I don't have a really worked out protocol in my mind separate from what I'm doing. So as I'm working, depending on responses to needling, I may change point selection. I may go in a different direction, that kind of stuff. So it's very interactive. Whereas Kampo, I'm already I've got a few formulas lined up in my mind that I think might suit this patient. And now I'm delving into my memory banks about asking very pointed clinical questions to either include such and such a formula from my possible list or to exclude it, right? So I'm going through this process of elimination in my mind while I'm with the patient. This is so that's also an ongoing interactive thing, but it's slightly more abstract in that sense.
Well, and I can imagine from, I'm also very much in the beginning stages of learning Kampo, and my style of acupuncture, Yoshimitsu, utilizes Kampo really for our approach with acupuncture and moxibustion. But, I know from my students' perspective and from talking to other TCM practitioners that when they start to learn Kampo and Japanese medicine, really for that matter, it becomes quite confusing for them to start to enact all of those different systems of thought. So I'm curious from your perspective, since you've taught Kampo to so many individuals for quite a long time now, what kind of advice would you give new practitioners or practitioners that are starting to learn Japanese medicine, especially Kampo approaches, to start to take out the TCM? I get this question so frequently. I want to stop doing TCM, but I'm just kind of afraid to go all the way there. Or, I still, I want to do Kampo, but I'm just not really sure. So I'm going to just throw in some TCM just on the side, I don't know if you ever get that feedback from your students, but how would you tell them to approach how to enact all of this knowledge?
Well, that's a really good question. Of course, it's a difficult one to answer, perhaps simply, but let me put it this way. to me, acupuncture is most dynamic and most effective on the level of chi. I mean, that sounds a little obvious, but it
Nigel,
really, so acupuncture is all about chi, isn't it? I mean, chi, it's about energy. And, I know that's a very broad term, and energy is in everything, and there's chi in the blood, and there's chi in the fluids and all. But at some point, I think it's important to make some discrimination in one's own mind and body about differences between disciplines, because yes, they're all linked, but they're not all the same. They function very differently, in my opinion. And I think it's important to grasp that. It's taken me a long time to start to sort of feel like I'm getting some sort of a handle on that. But what I mean by that is, yeah, when I'm working with needles, I'm in Western terms, I'm conceptualizing and feeling very connected with the main communication systems of the body. And to me, that means the nervous system, the endocrine system, and the circulatory system. So, in circulation, particularly, is moxa. So, I'm always thinking very systemically when I'm thinking about needling and moxa, which doesn't dissociate the effects of those therapies from effects on the organ function, for example. But I've never really been convinced by what I was taught in China about, when you needle spleen 6, then you're draining damp from the lower jiao, and it just didn't make any sense to me. In fact, years later, when I historically discovered that, in fact, that language had been borrowed from herbal medicine and applied to acupuncture, that began to make a lot more sense to me. Like, oh, wait a minute, I see. There's been a lot of kind of mismatching or miscommunications between the disciplines, and assumptions that you can just use the same language in each case, and that's okay. I think that's very misleading, actually. And again, I'm sure there are many people that might disagree with me, but when I work with herbs, I'm thinking about the organs. I'm thinking about the internal functioning of tissues of the body, and making potential changes to the yin substances of the body. So I'm particularly thinking, imagining blood and fluid pathologies, dampness problems of blood stasis, problems that occur on those yin levels that are stubborn and recalcitrant and require basically biochemistry. They require some chemistry to sort of make changes at those levels, in my opinion. Now, I'll give you one example where you can have a crossover. Let's take oketsu, blood stasis. Now, that's a term that I think is fairly well understood, and yet in our medicine, and yet it operates at different levels. For example, there can be forms of oketsu which can be easily managed by acupuncture. And to my understanding of how that works is that form of oketsu means that the blood is not flowing properly in the vessels. For some reason, it's either too dry, or there's an actual, there's a heat pattern or something but nonetheless, it's in the vessels. But there are other forms of oketsu whereby blood presumably extravasates from the vessels, or gets stuck in tissue, or becomes old, and as they say in Japanese, decrepit blood, like old or useless blood that's not functional anymore. And that's now in the way of things. And that has to be kind of broken down and reabsorbed by the body, and probably excreted also from the body. And that's a form of blood stasis that I personally believe you need herbs for that kind of stuff. So I've just given that one example because there's a link between the disciplines there. In other words, you can treat certain forms of oketsu from acupuncture, and you can treat other forms with herbs, but they're not necessarily talking about exactly the same pathology when you get down to the details. So I think these disciplines are hugely complementary, but they target different, I think more systemically in acupuncture, I think more, nitty gritty, particularly GYN and GI systems in herbs, because these are systems in which things get stuck easily, and you have to go in and often change the environment, the actual chemistry of the body. And I think herbs are very good at that, actually. But if we're talking about emotions and experience of energy, for example, and all of these very important things in our clinic that people complain about all the time, acupuncture is brilliant for that. So, that's why these disciplines, if you don't, practice them all yourself, and there's no reason why you should, because there are plenty of good people out there who can complement what you're doing. That's why you need to have access to other people that you can refer to, because if you're not going to supply all the different disciplines, then make sure you know someone who does one of the complementary disciplines and use them, because you're going to have patients who will not always respond to one discipline, in my experience anyway.
I think that's really, really good advice, and a really good way to describe the differences and also how the different forms of medicine can really communicate to each other on semi-different planes and help a patient to get better at the same time. So I really love how you explain that, and really good advice too, because I think some acupuncturists feel that when they refer to other people, they're simply stating that they can't help people. And that's really not the case. You're referring to other people because you know that you can't do everything. So I really, really love all of that. And with that, unfortunately, we're going to have to say goodbye to Nigel for today, because I do believe he has to get back into clinic. He's waiting for a patient to come in right at this very moment.
Yeah. Sorry about
so
that.
You're totally fine. So I do want to say thank you so much, Nigel, for explaining your approach to the medicine and all the advice you have given to practitioners who are wanting to learn Japanese style medicine, shiatsu, Kampo in particular. For those people who are looking to study more with Nigel, I'm going to go ahead and put in the description box below a link to all of the upcoming teachings that he is doing. So you can find all current teachings in the description box below, and that will be more than likely, I believe, your website, I assume.
The website's the best, because there's an events tab on the website, and you can pull up everything there. So that's probably the simplest. Yes.
Perfect. And then for those who are looking to really get a foundation to go and study with Nigel, again, get the education that Nigel got when he was in Japan. That's exactly what ShinKyu University was built for, was to give you that foundational knowledge of how to your acupuncture and your moxibustion, and in a very in-tune way, in a very palpatory-based way with your client. So you can check out a link to ShinKyu University in the description box below as well. And if you have any questions for Nigel or for me, you can go ahead and put those in the comments, and I will answer them there. So thank you, everyone who hung out and listen to this conversation. Thank you so much, Nigel, again for joining. I really appreciate your time.
Thank you, Maya. It's a pleasure. Thank you so much.
All right, everyone. Thank you again. Don't forget to like, subscribe, and hit the little bell, and I will see you next time. Okay.